sir. Yes, sir. Yes, sir. This is good stuff, folks. If you all have just joined, I'm Dr. Franco Taylor here on the Right Stuff Helps program. We're bringing the right stuff, and we got the right stuff man himself, Dr. Lane Rolling, and he's giving us the 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 on infectious diseases, viruses, and even this COVID-19. So again, I want to take a moment here just to say that Dr. Rolling completed his residency and his internship in foot and ankle surgery at Tripler Army Medical Center in Honolulu, Hawaii, and served in the United States Army for 4 years active duty and 2 years reserve. Now, let's listen to some military qualifications. Combat Casualty Care course, Advanced Trauma Life Support, Advanced Cardiac Life Support, Medical Management of Chemical and Biological Warfare. Folks, are you listening to me? Patient course there. In the military, he was actually an airborne Pathfinder, Recon, U.S. Army Master Fitness Trainer, and Scuba Qualified. I'm talking about this brother, airline, sea, and air, whatever. He's done it all. He's been there. And so he's got qualifications that I'm hoping that you all are not just looking and listening and moving on and realizing that we needed facts. We're getting facts. This is not Mickey Mouse like he says. This is not conjecture. This is not theory. Are y'all listening? This is scientifically done. And he's done enough scientific training and been around enough of these situations to know this is the real deal, folks. So now, here's the question that I'm going to ask you now. Again, we said about the vaccines, but now I'm going to ask you this. Reopening of America. What do you say? I mean, is it too late? Is it too soon? Where are we? Are we safe? I mean, what's the deal? I know you've kind of touched on it, but what's the deal? What's the deal?
Well, the reality is that we have to get back to the economy. And so people have to get back into a normal sense of being. But folks, we're not going to back what it was 6 years ago or 6 months ago or 6 weeks ago. The new normalcy is over. It's new. You're not going to be shaking people's hands in the future. When we talk about opening the system, the society, you have to have a stepwise, what we call biosafety and biosecurity protocols. I'm on a counterintelligence worldwide unit that fights foreign and domestic individuals. I'm the chief medical officer for this unit. And we tell people that you have to have systems in place. Kids go back to school, you better have some biosecurity protocols, i.e., you better have a full body decontamination unit in front of your school so all the kids are decontaminated before they go into the school. You better have a hand washing protocol that everybody follows. You better make sure you have the right technology because biosecurity and biosafety is done in layers. So when we're talking about, okay, go back to the football game, the stadium, these people on the beaches right now, not practicing any biosecurity, any social behaviors, but wearing masks and washing their hands at these bars. And, I told you fingers and feces are on these credit cards and money. Ball game over with. In 2 weeks, you're going to see what I'm talking about. You can look at the numbers now. Every week, these states that open up, there are thousands of cases. Texas is going to be shut down in about 6 weeks. And what are you going to say? What's the excuse? We didn't know? You can't argue with the science. You cannot argue with the medicine. And a prime example for all the people that are listening, look what Sweden did. Sweden was supposed to be this frontline, educated, white society. And they told the people, no quarantine. And guess what's happened today? That country's got shut down because people are dying. They don't got enough body bags for everybody. And they're saying it was a mistake. They should have done quarantine so they could catch up and be ready. And so you go open this economy up and they don't have protocols and procedures, there are going to be a lot of hurt people. And who are you going to sue? You work at Denny's, you work at Waffle House, get your butt back to work. What happens when you get infected in that place that they don't have any biosecurity protocol? Who are you going to sue? What's the excuse? Especially if you get put in a body bag, they're going to zip that bad boy up and you're going to be a footnote. Life's going to move on. So you better protect yourself and have what we call situational awareness about where you're going. And really, do you really trust your government? Do they really have public policies, or is all politics? And what's happening with this disease, they made it into politics, and that's killed a lot of people.
Wow. Folks, if you have just joined, this is Dr. Franco Taylor here on the Right Stuff Helps program, and we've got Dr. Lane rolling with us, one of the top virologists in the world, infectious disease man. I'm about to call him Dr. Man, to the rescue, because he's got it going on, folks. And we're getting the truth. We're getting it straight, uncut, no mixture, just the straight, real deal. And I love it, love it, love it. Now, I know a lot of these questions are kind of overlapping, Dr. Rowling, but the question I have, is there a protocol that doctors are using or advising their patients about this COVID? And do you find that the doctors are being effective at all in their handling the pandemic? And if so, what should they be doing, the doctors, to their clients?
I'm going to be honest with you. I think that's all over the board. I think these doctors are scared. They really do not understand infectious diseases. I told you earlier, I've had 18 of my friends die within the last week. It's on my Facebook, the names, the pictures. Doctors' mothers have died. We're down from 58 doctors down to 4 now. And they do not understand viruses. And you look at CNN and Fox, you got these pundits on there, and they're just pundits. They've never been in the jungles. I've never seen them in the jungles. I've never seen them in my BSL-4 lab in Fort Detrick, Maryland for biological warfare. I've never seen them in Germany. So these people got all these opinions, and they just got people confused. And that's one of the reasons why they end up putting me on the National COVID Healthcare Task Force for COVID-19, the National Black Caucus, because they wanted Dr. Rowling to tell the truth to our people. They want to keep it real. Because black folks, you look at CNN and Fox, all you see is a bunch of white people talking. They damn sure ain't talking about us. Mm-hmm. So the bottom line, at the end of the day, I don't think so. And because they scared. They're not trained in this stuff. And it's nothing heroic about viruses. Trying to treat viruses if you don't know what you're dealing with, looking at. And I guarantee you, just like the nursing home, hospitals are contaminated with COVID-19. You got to be careful going to the hospital because they're going to be infected. If the doctors, are they testing the doctors every day? Every day testing the doctors? Because there's 40 different strains out there. One day you could be positive and then you get better and then re-affected again, like what's happening on the aircraft carriers. Maybe one day you're negative at the job and you go walk out the door and you turn positive. Everybody in America from the future on is not one test, Dr. Taylor. You're going to have maybe 9, 10 tests a year for COVID-19 moving in the future. Because I don't want you at Chuck E. Cheese or Pizza Hut, and I bring my grandchildren there, and you're affected, and you're affecting my children because you got to work. Man, I want to see your certificate that says you're COVID-19 negative. So you're exposing people, just like the bus driver in Detroit. He's on the bus, lady in the back, coughing her head off, not doing anything, being nasty. And you guys all said that. He was dead within 10 days. This is not a game.
Wow, it surely isn't. So looking at what we've been talking about up to this point, individuals, what should each individual do? As your father in your house, husband, you're in the house. What should you do in your house, in your family, in your circle?
Well, in your family, in your house, you need to make sure that you have the best security protocols that you can have for your family. So your family comes from the outside in. First thing, man, take them damn shoes off. Second thing, you better be washing your hands, on a regular basis. Sometimes I wash my hands 15, 30 times a day. And what people need to do is call Save Hands, Save Lives, and get Dr. Rowland's antiseptic wash. And the number for that is, Dr. Taylor, write the number down so you can give this to your people, is 443-457-8233. Let me repeat this again. 443-457-8233. And people, you need to call and put your order in, because we're going to run out when the second wave comes in the next 3 weeks. Because just like when this thing started, you couldn't find toilet paper, you couldn't find alcohol, you couldn't find stuff at the grocery stores. Call my people and say, I need this stuff. Put your order in, because when the second wave comes, ain't going to be none of this stuff. Period. End of story. Wash your hands. And we also have pediatric antiseptic hand wash for children. And we're going to talk about Uncle Kuski at the end of the
We're going to do that. Yeah, absolutely. Wow.
Then you make
wow.
sure that you have a good air filtration unit in your house, because COVID-19 is in the air. And that air filtration unit has to have the ability to kill coronavirus, influenza in the air. You're going to make sure that you use the bathroom. Somebody's in your house is infected. You need to, and it's very difficult because of our people. One of the things when they put me on a COVID-19 healthcare task force with G.A. Carmichael, chairman out of Tennessee, said, Dr. Rowland, Black people do not understand we're going to be destroyed, just like HIV, because people are going to lose their house. They're going to get these employment checks. There ain't going to be no jobs. Education, Blacks are going to be further back in the education, because what's happening now, we're going to be behind the 8 ball. So we have to protect our people. We're going to have to pick ourselves up by our bootstrap, because the bus has already left. And so we need to make sure that we're in there doing these protocols. You have somebody, so in a family that has 9 people, maybe 3 generations living in one house, and grandmother, somebody's infected, you better do, and there's no way you're going to social distance. It's impossible. Air filtration unit, mask, making sure the toilets are clean, shoes are not there, air filtration units, surface disinfectant, wiping things down every day, being smart, being proactive. You get sick, you get the symptoms, you get into the hospital, and don't wait. If your child gets sick and they have a fever for 5 days, red tongue, red eyes, lips are cracked, rash on their bodies is hurting, legs are hurting, you need to take them to the doctor right then, because they have that pediatric multi-inflammatory syndrome, or what we call Kawasaki. That's how you protect yourself and layer yourself in this. You get food from the store. Make sure that you're disinfecting the outside of it. Make sure you cook that food, that beef, that pork, because the chicken plants are infected. The pork plants are infected. The beef plants are infected. You see this, Smithfields, all these places. So these people are sick. Viruses are landing on the meat. And they wrap it up and they put it and they freeze it. Well, folks, freezing does not kill viruses. It puts them to sleep. And then when you get home and you open it and you thaw it out, you touch that, you can put that in your eyeball. Wash your hands. Make sure that you cook that food thoroughly, or you're going to be like the bat syndrome.
Wow.
That bat, that virus is going to jump from that steak, going to jump from that chicken, jump from that pork, that bacon into you. So make sure your food is cooked. Well done, not medium rare, not rare. It better be cooked through, just like we do for salmonella for chicken, like we do for E. coli for hamburgers. So this is good, common type of sense stuff.
Very good. Wow. This is just, the information is so powerful, it's almost incomprehensible, but it's real and we can see it and we know it works. But it's horrific to see that we're actually in a serious situation, a death-defying situation. And so I guess at this point, I'd like to go back to how we met. I have been doing what I've been doing for over 40 years. I've worked with lose weight, gain weight, high blood, diabetes, cancer, full-blown AIDS, and never healed anybody. But I spent all my time, Dr. Rowland, helping them to understand that if they would just work with their bodies, give their immune systems what they need, eat lots of live foods, fruits and vegetables, drink their water, get their just do the things to help God's body do what it was designed to do, which was to heal itself. Then when I got through talking to you and looking at your stuff and researching you, all the stuff you've seen, the stuff that I thought I'd seen just paled into nowhereness. So I prayed that God would send a formula. I have formulas myself. I have 12 products 8 of them are liquid, so they're 98% absorbable. But absorbable is the key. If the person wasn't eating right, drinking right, their body would get clogged up and it couldn't even use good stuff. So what do we do? I prayed that a company would come along with its millions and billions and just make formulas that would help the body heal itself. And I found that. In a company called Sankey. And they had one product in particular called Belage that literally had paper proving that it had efficacy against virus. So then I said, well, who can I take this to? Somebody's got to make me know that it's really real. And when I saw you and your daughter having a good time in an interview, I said, let me check this dude out. And I did. I checked you, man. I went all over the place. And everything, the closer I got to you, the taller you got. I said, this dude's about 18 feet tall. So let me tell you, I did this, people, and he'll tell you that I did this. I searched him out, and there was no number for him, so I simply sent him a message and said, look, I'd like for you, since I think you're the guru, I'd like for you to look at a product, a formula that I think is powerful for the immune system. And he didn't mix his words. He simply said 5 words, send me the white paper. Now, y'all might not know what that means, so I'm going to ask you, Dr. Rowland, tell them what the white paper is and why it's important when we're talking about things like this.
When we talk about white papers, individuals need to understand the white paper is the science behind something that works or does not work. When people are touting, the malaria medication, they're talking, that it works. Well, show me the white paper that it works against the virus. If they're telling me that Remdesivir works against, show me the science behind it. Because if you know the science, you understand the medicine. If you understand the medicine, you have to know the science. And we believe in science. I don't believe in Mickey Mouse theories. I don't believe in conspiracy. I believe in the facts. So when you sent me the white paper, I read it. The science is 100%. I believe in it. And I looked up and studied it, and I started taking Belage myself. And it's what we have to have. To have in this day and age of this pandemic, you have to have a nutritional supplement to give you more energy for your body, for your immune system to be able to help fight off infections. And that's nutrition. That's the bottom line. Are you going to be able to, take some magical pill that is going to turn your immune system on? You can take Belage. It's going to give you more energy to make your immune system more effective in fighting infections. And that's what it's about. And so that's the reality. That's what white papers do. And I believe in science. That's what makes me who I am. I don't believe in Mickey Mouse. I don't believe in Snow White. And I damn sure don't believe in the 7 dwarfs. I believe in science.
Praise God. Well, we appreciate you so much for, all the information you've given us. And I'm definitely looking forward already. I'm claiming you're coming back in another 2 or 3 weeks or so, because as this thing goes forward, I'm serious. We need you back, brother. Whatever we have to do. If I had to fly a Learjet out there and I don't know how to fly one, I'll come get you and bring you back. But the key, because hopefully things will be opened up a little bit by then. So we thank you for your candid.
Doing is good, Dr. Taylor, and I like you being proactive, and you have a good personality, and you're motivated, and I can feel and see the compassion in you trying to help people, and that's who I am. I mean, I don't care what people think about me. I mean, there are so many people out there who really are full of it. And it takes a lot of person to have character, compassion, to work for God, and you become God's right hand. That's who I am. He put me on this earth to carry babies' crosses, and I'm big enough and strong enough to do it. Even though I got a bad knee and I got a bad back, I can walk that mountain. I'm going to get to the top with my people. And that's what my job is. And that's why I sleep great at nighttime. And I want to talk to you before I go about what we're trying to do.
We want to do that. So that's where we're coming to now. And folks, I will make sure that you can see where you can go, link where you can go and find out about the Sankey formula, especially the Belage, and find out more about it and get your hands on it. Because right about now, you need to do something, not yesterday. Go ahead.
I'm going to tell you, if you don't get a Belage, folks, this is part of your biosecurity protocols. This is going to help save your life, because we got a long ways to go, at least another 3 years. So you need to make sure you're doing the best nutritional thing, a supplement that you can have. And this is coming from Dr. Rowland. period. And I'm on the COVID-19 healthcare task force.
Wow. Well, that's tight enough for me. Now, back to you, sir. You got some things going on. TPATA, I'm saying TPATA. I hope I'm saying it close to being the right thing. You got a boot camp that you're doing over there, so I'm going to make sure we got information up where they can get in touch with you about that. But is there anything you want to say about that boot camp?
Well, it's, TPATA is a tropical pathology infectious disease associate where I'm the director of clinical and educational. And this is a program, we have 2 programs down in Peru and 1 in Germany, and where students can come or people can come and train with me in the hospitals and see diseases in real time and give back to humanity. So we have a basic course in infectious diseases, and then we have an advanced course in what we call molecular medicine in the diagnosis of infectious diseases. So we know about PCR, we know about antibody tests. So we teach students that. And then we have a master virology course in Germany. And you go there and you spend 5 days with the top virologists in the world learning about viruses. And I'm one of them, from Ebola to Mars, influenza. So you get a hands-on how to put the BSL uniform on, et cetera, et cetera, et cetera, Dr. Taylor.
All right, that's deep. Now, you've got a fundraiser going on. Everything that you do, again, compassion. That's why I asked you that question first. To just sink in my mind and to just anchor the fact that you are compassionate. So now, this fundraiser, tell us about this fundraiser. What is it for?
Well, we have a fundraiser where we're trying to raise money for the doctors that are dying in Peru as we speak right now. They have no medicine. They have no oxygen tank. The system has collapsed. You can read the papers of what's happening in Peru, Brazil, Ecuador. Bodies are stacked on the streets. I mean, doctors are in plastic body bags, trash bags. No medicine, nothing. So this is what's coming to the United States, folks. So you need to get ready. So we're raising money to help support the doctors that are died, their families, and to make sure that we can get medications to the individual doctors so they can survive this pandemic. Because at the rate we're going, in 1 month, there aren't going to be any doctors. Wow. So I'm going to go down there and train the next residents and interns. I'm going to be the guy, the Lone Ranger on the horse with Tonto, going to rescue people and picking up the pieces.
Okay, and hopefully you'll be drinking your Belage so you can stay tough, man.
Oh, I want you to give me some of that because I want to take that to the native people that live in the jungles. These people are living there for 5,000 years. You know, they speak a different dialect. They're dying. So hell yeah,
all right.
Give me some. Take it to give it to the native people. You can take pictures of that. That's giving back. That's being a global citizen. That's global responsibility, picking up your fellow man, even though you don't speak the same language. It's beautiful.
That's deep.
How can you argue with that, man?
Can't. Well, that's powerful. Now, last on the list is something that had me giggling when I saw it, man. I saw this little dude look like a reverse Jiminy Cricket. I said, what is that? And his name is Uncle Kutsi, I believe it is. Tell us about that, because that touches me. I have 9 children. I helped deliver the first 3, and I delivered the last 4 at home. I have literally, out of my 9 children, 7 of them I've been blessed to actually homeschool them. So I love children. I probably have about 60 or 70 individuals in 40 years that I have just picked up and mentored, male and female. I love children, giving them what they're not getting. And so that's what I'm hearing here. Tell us about Uncle Kutsi.
Uncle Kutsi is all of us long lost uncle. He is a mosquito with a big belly. He has his top hat on, his cane. He has his tennis shoes and his great smile. He's a dapper. But Kutski's responsibility is to teach the kids on how to wash their hands, because nobody in the world is talking to children. They're talking to adults. They have programs for adults. So Uncle Kutsi's responsibility is to tell our kids and teach our kids about the pandemic in their language, teach them how to wash their hands in their language, and become their friend during this pandemic. And when people order our stuff, their Safe Hands, Safe Lives, we have pediatric Uncle Kutsi. antiseptic wash, and people can call and get it at 443-457-8233. And when you get that antiseptic wash for yourself, you get you some for your babies, because babies and kids, fecal matter, and this is going to take care of the bacterial, fungus, and also viruses, and it lasts 24 hours. And so Uncle Kuski is going to teach the kids how to wash their hands. And wait till you see the cartoon. And I'm giving a talk to the island of Hawaii in 2 weeks to all the kids in Hawaii about Uncle Kuski.
Watch out, Walt Disney.
Oh yeah, Mickey Mouse don't got anything on Uncle Kuski. He got the cane.
He's cool. He cool. He's cool. Oh,
please
wow.
Please share the character with all the people you know. I want them to know who he is, because he is responsibility that me and you can't do, Dr. Taylor. He's talking to kids' language.
He's talking to them. He's talking what they'll hear. That's right. Now, we want you to make sure you understand that Dr. Lane Rolling is he's available for speaking engagements, radio and TV programs, just wherever you want him to be to get this information out. Be sure to contact him. Now, I'll put the information up, the Tipeta, I think the information that you have on that, I'll put that up for him. I guess it says here, Marisco Gambra.
Go to the website, www.tpida.org, and they can hit the contact page, and they'll send me an email if they want me to talk, or if they're looking for information. It'll go to my email, and they can directly contact you, Dr. Taylor, because you have access. Yeah,
I'll make sure.
So you can be the buffer and make sure that people that are legitimate, they really want to talk to me, they can go to you, because I'm so busy in my time. So I got to make sure my time is maxed to the benefit, because our job is to save people's lives during this pandemic.
All right. Well, folks, like I always say, it's a plum pleasing pleasure being here with you. And this has been just a powerful situation for me. You've just kind of turned my heart around as to, every now and then you get to I've been doing this 40 years, and you wonder if people are paying attention. You wonder if the system cares, and you're beating your head trying to help folks down on the bottom, and nobody's giving them education. Well, they're giving them miseducation, and folks are just walking around just looking up in there, don't know what to do. And then Dr. Lane Rolling comes along, and it helps me to realize that it ain't over yet. So we're going to battle this thing, and we just lock arms together. It's just me and you, Doc. We going for it. And
Doctor, you set it up for. I'll come back in 3 weeks, and I'll give that's what I do. I give updates, and I guarantee you, the information is going to be different in 3 weeks. In fact, we might be in the second wave, and you're going to see the numbers. You thought New York was bad, New York going to be reinfected again, and you're going to see what I'm talking about. This is not a game. Just because you can't see it doesn't mean it's not there. And people going to these house parties and bumping and grinding and stuff. Well, when you're in a body bags are cheap. You ain't grinding and bumping on anybody. You're going to be a footnote. So you better listen to us.
All right, folks. Well, you heard it from the guru himself, Dr. Lane Rolling. This coronavirus, this COVID-19 is serious, serious business. And you heard it. I hope you took this serious. Hope you listened. Hope you took notes, copious notes, so that you can protect your family, you can protect your friends, and even strangers. You can pass this on. This is good info. It's facts, it's real, it's scientific, and it's even commonsensical. That's my word. So, folks, I'm saying again, this is Dr. Franco Taylor. Again, I'll make sure you can get the information on getting the Sankey Proctor, the Lodge, and all the information on Dr. Rolling. You'll be able to get that. And like I always say, until next time, this is Dr. Franco Taylor saying, I love you, and may God bless.
Balaj is the ultimate solution for promoting health at the cellular level. We are surrounded by toxins, which damage the cells of our body. We need antioxidants to detoxify and cleanse our cells and restore energy. Balaj has highly effective nutrients, which includes a proprietary blend of specially grown olive leaf and rosemary, assembled with our patented process to ensure that is bioavailable, meaning that it can be absorbed and used at the cellular level. Using the natural oils from the ingredients as a carrier, the nutrients penetrate the walls of the cell and feed the mitochondria. the cell's power producers. The mitochondrion provides the energy a cell needs to move, divide, clean, and contract to allow the body to heal itself. Ballage is easy to use and tastes great and contains 14 trillion nanoparticles. Ballage is truly a powerful food for the cells of your body.